Welcome to Beyond 2020, a project of the Nebraska Optometric Association. I'm your host, Dr. Andrew Bateman. With me today we have Dr. Jackie Nielsen from the Beatrice Public Schools. She's the Assistant Superintendent and is the Director of Curriculum, Instruction, Assessment, and Professional Development. Did I get all that down?
Along with many other things that, just get added to the plate, but yes.
Well, welcome and thank you for joining us. One of the reasons that we wanted to start this project was that I noticed that when I was with patients who were teachers or some are admins here in Lincoln, we'd start talking about education and just learning and eyes and things like that. And their comments were like, oh man, you guys aren't ever really, we don't talk about that a lot. And so one of our goals as an association is just to get optometry to be a resource for people to use, whether it's education or public health in those worlds, and see how that all goes together. To us, it makes sense that the eyes would be pretty important for learning, but in certain ways that doesn't always the first response for people. So thank you for being here.
You're welcome. Thank you for having me.
So you really helped this last, about a month ago, right?
Yes.
A project that was sponsored by the Beatrice Public Schools, Nebraska Foundation for Children's Vision, and the Nebraska Optometric Association to, it's kind of a pilot project. So trying to help figure out how we can help children learn better. And part of that was screening out vision issues. So can you tell us a little bit about that project and how that came to be from your guys' point of view?
Awesome. We met probably before COVID even was thought of. Met with a couple of individuals who were from the associations and really started saying, okay, what can we do? We have the reading legislation that the state had just put in that by third grade they wanted to ensure that all kids were able to read. Which is great. However, there are other problems that come in the way when you're talking about reading and just making sure that our kids are on track. So we started talking about how can we address the vision problem just to make sure that that's not a barrier, because if that's a barrier, then the reading will start to lag behind. So we decided, we were asked if we wanted to be a part of a grant, and I usually do not turn down grant opportunities just because it is free money. And especially when it benefits the kids and it benefits the community, it benefits our staff, it benefits our schools, it benefited everyone. So we started kind of brainstorming, wrote the grant, got the grant, and then started looking at, okay, what can we do? What different things can we do to help ensure that we move forward, and how can we take this to the next level? One of the nice things that we had in place was we were actually working with our Beatrice Lions Club, and they brought in the initial vision screening. And so they did a pretty intensive screening with our kids. Normally we do kind of just a cursory glance of where our kids are and use our school nurses to help with that process. But the Lions Club, they were able to go a little bit more in depth with some of their equipment that they were able to bring in, and were able to help fund that. So they did the initial screening. We came up with 77 kids that we were looking at K4 to say, okay, these students need just additional screening. We sent home letters to the parents, and some of the parents said, okay, just go in and we went in to see our own optometrist. Other parents maybe did not have access to an optometrist, or to just maybe they didn't have access to healthcare. And so that's when we took that next step. We worked with many different partners and said, okay, how can we get our students in on a full day of screening? And it was an amazing experience. It was fun to watch the kids, fun to watch the optometrists work with them. We had 5 optometrists come from around the state, around the southeast part of the state, and it was great. Excellent.
So that was the grant. I think it was from the Healthy Eyes, Healthy Children community grant, which is part of the American Optometric Association. It's sponsored by Esler Vision Foundation, the Healthy Eyes Advantage, and eyecare partners, which are all kind of players on a national level for vision and children's vision. Locally, though, the optometrists that got involved, and we're excited about this. So the way they provided the exams, was that in the schools, or did they have a mobile examination vehicle that they brought, or what was the setup for your guys' project?
We actually did it in our administration building, which we used our boardroom because it was large enough, plus we could dim the lights in certain areas. But all the equipment was shipped directly to us, and I'm not for sure who made the shipment, but and the optometrists were also brought in some of their own equipment too. So everything was set up, and they started through the rotations. The kids moved and did different stations, and they were able to, we dilated eyes. For some kids that was a little bit more concerning than others. The drops, they did not want that. Yes. But, and at the end, what was nice about it was they were able to figure out, do they need glasses? And if so, they had frames right then and there. So the kids could try on the frames, the kids could see what they were going to get. And very excited that this Friday, coming up Friday the 19th, we will be giving our kids their glasses.
Excellent. So you said there were 77 identified for the screening part, correct?
Yes.
So the screening part was the part that the Lions Club or the nurses did. And then of those 77, how many of them actually had the exams? Was it 20?
We had 24.
24, excellent.
Yes.
Do you, by any chance, if you had a chance to look, of those 24, how many of them ended up needing?
19.
19 of the 24 needed glasses of some sort. Wow.
Yes.
So I sometimes do presentations for the School Nurses Association for some of their CE and those kind of things. And we talk about, for children, one of the data sets that they've started doing research on is that 1 in 5 children enter school with a binocular vision deficiency. And so one of the issues with that is hard to pick up. You don't just read a chart. A lot of those kiddos can read a chart and read the 20/20 line and do fine. And my personal story of how I got interested in optometry was that when I was a 6th grader, we had to take a test that told you what classes you could take then going into junior high, what science, math, etc. Well, my science and math tested really high, but my reading and English tested below where I was even performing on a day-to-day basis in school. And so luckily my parents were teachers, and so they started asking some questions, and one of the first things I did was go get my eyes checked. And so I see 20/10 without my glasses on, so that's 2 lines better than perfect vision. But my eyes don't work together as a team. And so it was simple enough that I just needed to wear glasses going to school, and I didn't need to wear them for sports or any of those other issues. But my parents had no idea because I could see everything that I needed to see, right?
Absolutely.
So that binocular vision component kind of comes into play, and that's where the full examination really helps. And so we try to help the nurses and the Lions Clubs and those kind of organizations to help improve our screening. But with kids whose decisions in terms of their education come into play for whether they need to go that extra level with like an IEP or those kind of things, we'd want to remove all those barriers, right? And so, from your standpoint of going through this process and seeing, were you surprised that 19 of the 24 kids needed glasses? Was that something that surprised you?
Yes and no. I do think, what it really, I think, says is that Lions screening did a pretty darn good job.
Yeah.
And that was awesome that it was such a high rate, a high percent of students that actually needed them. So that initial screening truly worked and truly did what it was supposed to do. So that right there was fantastic. I do think that, kids, and I know that the screen time is affecting eyes, and there's more and more of screen time, but also with looking at schools and looking at that remote piece and making sure that our kids understand how to use the device. And even schools are adding more screen time, and so I do think that is a concern, and that is kind of not helping with that vision.
Sure. Well, and I know one of the implications for you as school systems and trying to administer something like this is, okay, so we identify these kiddos that need an exam. How do we get them, for the ones whose family don't have access to health care, what resources are out there to be able to get them help? And that's another area that, I think the NOA, the Nebraska Optometric Association, wants to be available for school systems is to call, because there are definitely programs that can be accessed, and then in some cases in small towns, you can call the optometrist and they may have something they just do on their own, and so I think we want to get some information out there to the school districts too. Like, do you have any advice on if a school district wants to do this, or how they could kind of get a program like this going? What are the first steps from your point of view of doing that and moving forward?
I would say start with your optometrist in town, just because, we were approached by Dr. Michaela Betka. Well, she works with Dr. Salmon in Beatrice. And so it was nice that she kind of created that connection, and then we expanded. But that is where I would start, is with the optometrist in town, because there might be some things that they know of or some resources that they can provide. That would be probably where I would start, but even your school nurse. Start with your school nurse. Your school nurse may be able to help reach out, and even, the Lions Club. It was just amazing how everyone came together and worked as a group.
So with Beatrice Public Schools, for a kiddo entering like kindergarten, is there any kind of like a screening requirement or an exam requirement for children entering school at this point in time?
Yes, there is. There is a requirement that they have a vision screening before they enter kindergarten. But even at that kindergarten level, you don't necessarily see, their eyes may not be fully developed yet, their eyes may not have problems. I know, for example, my youngest daughter was fine. And now wearing glasses in 4th grade. And so, it takes a while for those eyes to develop and for you to start seeing some of those complications that may arise.
One of the things I think that we run into also is that I believe across the state there's either a recommendation or a suggestion for a vision screening going into kindergarten, but you can also opt out of it as a parent. And, us as optometrists can talk about you should get your eyes checked, but of course it's easy as a parent to be like, well, that's what they do is check eyes. So, for you as an educator and participating in this kind of project, does that change at all how you have that conversation with the parents from a recommendation standpoint, or what do you think is the best way to kind of explain to parents or reach parents so that they do value getting that done ahead of time before school starts?
I think it is one of those things that we continue to push, and we continue to let parents know that vision is important. I will tell you, one of the things that we may face is if we do recommend that they go in for a vision screening, well, now the school is responsible for paying for that vision screening. So we aren't necessarily going to recommend it, but I think just making sure that parents have information, providing screenings that we do, working with your Lions Club, providing those pieces that you can bring in, because then if I have that data, then I can then make that recommendation to that parent that this screening came back. You may just want to see your optometrist, but it goes back to their court. I think even educating teachers. And, we have some fantastic Title I reading teachers that focus solely on reading. But they will even notice that maybe this isn't a reading deficiency, maybe it's an eye, maybe it's a tracking, maybe it's something else with their eyes that are causing them struggles as they're reading. And so I know that there are times that they even bring up, you might want to have your optometrist check out this because this might be a concern. So I think just having those open lines of communication with your parents, open lines of communication with the teachers, with the staff, with the administration, just to say, this is an area that needs to be addressed. We may not need to put them into special education because they don't need it. They need glasses, or they need some vision therapy or other pieces.
Yeah, and I think that's a big thing too for parents to understand about the development phase, because one of the resources that's available out there, and I know that you don't get them necessarily till they're 5 years old, but like the Nebraska Foundation for Children's Vision participates in a program called See to Learn, and most of the optometrists in Nebraska are See to Learn providers. So it's a pretty free, comprehensive screening that works on how are the eyes tracking, how are they moving together. We're not asking the one or two question that most people think of when they're talking about optometrists, but seeing how that system is getting there, and we can head off a lot of issues before they hit that kindergarten level just during that screening. And so getting that information out to parents is something we are trying to do a better job of. But even with like the school nurses, that's the Nebraska Foundation for Children's Vision is a great resource for them to be able to reach out to get that to resources to the parents. I think when it comes to children and learning. More and more we're learning about early childhood, so that's pre-kindergarten and whatnot. And you mentioned briefly the idea of possibly having to move into a special education role or area within a school. And I think it was back in the late 2000 or early 2000s when kind of the ADD, ADHD was really taking off, and that was when the binocular vision research really started taking off also in terms of how this was affecting children. And parents will say, well, vision, what do you mean by, they can see the signs, how does that really affect them? And I kind of use the analogy of they will answer questions, and it has to do with how the eyes are moving. So we use fixation, which is grabbing the first letter, let's say on a word, pursuing across the word, saccading or jumping to the next one. All that time our brain's using visual memory to put it together. And so when they're young, and if that system is getting interrupted because the brain has to focus on moving the eyes instead of comprehension, it starts to shoot their confidence down. And so then you're moving into another realm from vision, even though it's a part of vision, but that confidence builds in how they learn and how they grow and how they interact within the classroom and whatnot. And so if we can head these things off early, that's our goal, just to try to remove one barrier from learning and in the learning process if necessary. So do you have any questions specifically about the eyes and learning, or how Nebraska Optometric Association can help out school districts or anything like that?
No, not necessarily. I do think, how can we do this again? I mean, how can we continue to do this? Especially if you do have barriers such as funding, how can this be a constant part? Is it a yearly? Is it every other year? You know, how often would we need to pursue this? I do think those are all questions that would be good for districts to understand, but would be good for a partnership, just so that we can continue providing our kids. And because you're right, I do think if kids don't see success, they create other problems. Sure. And so it is so much easier when we see success, when we are able to read, when I'm able to understand and comprehend what is going on in any subject that I'm given, because it only builds and it only gets harder as you move forward.
Well, I think that was what's great about doing this first project with you guys and kind of getting down, everybody, whether it's grants or whatnot, they want data, right? They want numbers that they can use to track and show the importance of what's happening. And so, I mean, one of our goals would certainly be to be able to do this, more frequently, be able to gather more data, be able to get people in front of the right help that they need. So, we really do appreciate what you guys did by stepping up and being kind of the first district to really do that here in Nebraska. And we do track what's happening in other states in regards to this, and we're hopeful that we can maybe kind of help lead some of that discussion across other states and get people in the right areas. So thank you very much for joining us. I do want to have a couple of thank yous out there for the Executive Director, Dave McBride, for Nebraska Optometric Association. He was really big in putting together this project. And then for today, of course, Christian Anderson with Right Eye Digital, Dan Parsons with Parsons Public Relations. Really big thank you, Dr. Jackie Nielsen from Beatrice Public Schools, and what you guys did for stepping up and putting this in play for the kids in Beatrice, and then hopefully for the other kids in Nebraska in the future here. So we do want to encourage everybody to look for the latest episode of Beyond 2020 at bettereyecarenebraska.com, on the NOA YouTube channel, and all your favorite podcast platforms, and also follow us on Facebook. If you have questions, please contact us at Nebraska Optometric Association. Until next time, thanks for watching and listening.